Good afternoon. It's so great to see everyone. I recognize I'm part of like the after lunch crew and you've been sitting for a while. And I'm going to talk about policy, which to a lot of people sounds like I'm going to tell a bedtime story. Like I'm one of those people. I know I got some others that are like, I get really excited when I think about policy because to me it's all about like how do we take things and scale them up? How do we unlock barriers? How do we allow innovation to move forward? And then like when innovative things work, how do we make those happen more and more? So this is kind of what gets me really excited. Just gonna make sure this works. Okay. So before I start, I want to say just a quick thank you to Stacey and Ertern for having me. And also to my student, Mike Orlando, who's up there, who helped work on with me the policy section of the report that was released today. And so I think that the policy section there, and what I'm going to talk about today, really just scratches the surface of, what the opportunities are, but just to kind of give a plug for like what you should be aware of, what should be on your radar, and then kind of how to partner with us and how we hope to continue to be supportive. And we work very closely already with food systems for the future, but I'm hoping that there's a lot of energy generated around this. Um, One other thing just to say, because the last panel was talking about Clarksdale, Mississippi. So I owe a huge debt of gratitude to Clarksdale and the Mississippi Delta because I spent 2 years there after law school doing community-based work with my law degree that got me into food. So everything that I do now, all the work I do is because of the things I learned there from that community. And we have an ongoing partnership. We've had a fellow on the ground in Mississippi since I was the first one in 2008. So we have a fellow there still, and we continue to do work there. So I'm excited. I think bringing from community-based experiences, and something that I bring a lot to my work is, now for the last 15 years, I've been in Massachusetts. Before that, I was in Mississippi. When I see problems that are the same in Massachusetts and Mississippi, there has to be a solution for those. We have to be able to solve those problems. So just quickly, the organization that I started based on my experience there is called the Food Law and Policy Clinic. It's part of the Center for Health Law and Policy Innovation, which I also direct. And we have the Food Clinic, which runs all this work on really educating people about the laws regulating food and then trying to work on policy change. And on all that work, we have students like Mike that get to do this work and learn about leadership and learn about the food system and the laws that regulate it. And then on the health side, same thing on health policy. Of course, food and health intersect a lot. So we run a huge amount of our work on food as medicine, which is one of the policies I'm going to talk about today. And I think just to say, one of the important things that we do and that I think is hopefully you can all use as a tool is both really trying to help people understand the laws that are out there and how they can use them, and then really help work with them to figure out how do you unlock the barriers. So I'm going to talk about 4 topics really quickly. I could do at least 10 minutes, if not 10 hours on each of these. I'm going to give you just like a little sampling. So the first thing, and a lot of these actually people have talked about today, which at first I thought maybe it would be repetitive, but I think maybe thinking about these together as some of the policy opportunities. So we've heard already numerous times today about these federal food assistance programs and how important they are to all of the stores that we talk to, as far as getting people in the door and making sure people have enough money to spend. And so the biggest one is SNAP, $113 billion last year. As we heard, thanks to Stacey for making it that much money. It's a lot more than it was before. And I think that's a really important one, that the work of policy in the coming months and years is going to be maintaining that, making sure that that money exists and that people are still able to be eligible. And then also thinking about moving forward. A lot of people talked about online SNAP, and we know that's still a barrier for a lot of retail models, whether new stores or small stores, in particular because SNAP isn't allowed to cover the delivery costs. So just a thing to think about as we're thinking about policies and opportunities. And another thing that we talked about in the report a little bit that came up in some of the interviews is the timing of benefits. So if everyone gets their SNAP benefits at once, that's really challenging for small stores to manage that. And there are a lot of states that have done things like people with certain last names get their benefits on the first day of the month, and the other last names, they get their benefits in the middle of the month, and it evens out some of the flow in stores. WIC, of course, is really important. We heard about this as well, about some of the barriers there. It's a much more circumscribed program in terms of what's allowed to be sold, but that also creates challenges for stores. And I think one thing really to think about for this ecosystem is, are there opportunities to really think through like scaling WIC? And the cool thing we heard earlier was WIC is actually a lot of those decisions are state by state. So there's some room maybe to innovate on, how does this work for stores at different scales? And then I want to flag the GusNet program, which we also, a lot of people mentioned Double Up program. There's two different components to this. One is what you hear of like Double Up or nutrition incentive side of it. Last year, about $36 million was used in grants for that, and it provides customers that are on SNAP in places that have received a grant to operate this or that are doing it through, through other philanthropy. It provides the ability for them to receive a matching amount when they spend dollars on fruits and vegetables. And then separately, there's a component of it called produce prescriptions. It's a smaller amount. I'm going to talk about that in a moment when I talk about food as medicine. One thing to think about with the nutrition incentives program has been, how do we increase it? There's, the 36 million, it becomes grants to certain communities to be able to do this. And I think there's a lot of evidence that this works. How do we increase it? And then the other thing to think about is, how do you prioritize where those dollars go? So I was just looking, and for example, Double Up New York, there's a $5 matching per day when you spend the benefits at larger stores, and $20 benefit, up to $20 per day when it's spent at small or independent retail or farmers markets. So there's ways to play a little bit with the matching as well, to really be thinking about like, what are the locations that could really benefit from this? And especially it aligns with more and more states thinking about how are we supporting more food access. So if they're putting money in on one end to support like corner stores and building new groceries, then why not also talk about, can we align some of the benefits to have that investment go to the stores that we're already building? So again, I know I'm scratching the surface, but I'm going to be here until afterwards people want to catch up about any of this. All right, I want to talk about food as medicine, which we've heard a lot about today. Again, just like a brief overview. So this is a pyramid that we use a lot in our center because it really shows that food as medicine is kind of all levels of the food supply. So at the very bottom, that's really like, that's the everyone. Making sure we have population level, like access to healthy foods, that it's the things we talked about earlier around making sure that it's easier for people to make healthy choices. And then nutrition security programs, which I talked about on the last slide as well. These are for everyone. But as you go up the pyramid, we start thinking about what we would call in our center food as medicine interventions, which are the provision of foods that support health and have some nexus to the healthcare system. And so again, we'll see like the produce prescriptions, there's more of those. There are a lot of different coverage for these that are coming from private philanthropy. And then in some cases, Medicare, Medicaid programs. And I'll talk a little bit more about that on the next slide. But we're seeing a huge amount of growth here. I mean, it is happening really quickly. In the last 2 or 3 years alone, more than a doubling of states where these are offered as part of either Medicare Advantage or Medicaid programs, and more states coming online. It's really important to be in the know about these. And I think especially for like smaller stores, independent stores, rural stores, making sure that you are doing everything you can to be able to participate in these programs, to be able to keep a competitive advantage. So kind of keeping abreast of that. So I'll show on the next slide, this is a static map, but in exciting news, we are building a dynamic map because so many more states are starting to offer food as medicine interventions in Medicaid programs through various waivers. We're going to be launching next year a map that will keep up to date with dynamically like what's offered in all your states. Hopefully this will help again for those of you who want to be able to participate in these, to know what's coming, and even knowing when it's proposed, to have it on your radar, because you need to really be in the mix to be able to benefit from consumers spending their produce prescriptions or some of the other services, nutrition counseling, meals and pantry stocking, produce prescriptions. Medically tailored meals is a common one. I think it's less relevant probably for retail because it's actual whole delivered meals. But all of the ones that are produce prescription, medically tailored groceries, things like that are going through retail. So what this map shows are the states in red have now an approved 1115 waiver, which is one of the different Medicaid programs that states can opt into as part of their plans. And those states now are offering some type of food coverage for Medicare, for Medicaid beneficiaries in their state. It could be limited in most cases, it's limited to people with certain disease states like diabetes or pregnancy, not a disease state, but a health condition. And then the ones in yellow have waivers that are pending, that they file them with the Center for Medicare and Medicaid Services, and they're waiting to hear back. Outside of 1115 waivers, there are other kinds of waivers and state plan amendments, 1915C, 1959. I'm scratching the surface, but I think just saying more and more of these are coming online, and they're going to get more money into people's hands that can be spent in stores. So it's really important to do what you can to know about these. And we have a ton of information, so I hope you'll connect afterwards if you're curious about your state. The report briefly also talks about Medicare Advantage, which are private plans that support people on Medicare. And now there's been a huge growth as well in Medicare Advantage plans covering food. So the most recent data shows almost 1,700 plans across the country are going to cover some amount of food for their recipients in the coming year, which was like a huge growth based on a law that was enacted in 2018 and went into effect in 2020. Okay. So the next topic I want to talk about that we heard a little about before was about food donations. So we heard about some models that are using donated food to reduce the cost of the food that they're then selling in stores. And there's a couple issues. This is something I do a lot of work on. One big one is that stores, in order for donors to be willing to donate things, they want to make sure that they're not going to be liable if someone were to get sick afterwards. We've had long-standing liability protections in the U.S. since 1996 called the Bill Emerson Act. And through a lot of work and a lot of partnerships, that was changed in the end of 2022 with something called the Food Donation Improvement Act, which actually amended that law to make sure that it's clear that protection applies, whether that food is given away for free or if it's sold at a low price by a nonprofit. So this right now, it benefits any nonprofit models of distributing food, nonprofit retail, et cetera. And the idea is really that the donor of the food, whether that's another retailer or wholesaler or farmer or, whoever that is, if they give it to a nonprofit that either gives it away for free or sells it at a low price, they'll be protected. And this is a screenshot of a fact sheet we have about it that I'm happy to share with anyone. And one other just follow-up to that is that there's, this is a map of state tax incentives. I didn't really have a great tax incentive graphic, and I didn't want to give you a lot of words, but there are also tax incentives for food donors. And one barrier that remains at the federal level is that there's still a restriction for food that is donated that has to then be given away for free. So that can be a barrier for food donors giving it to a model that's going to then sell it. A lot of businesses max out their tax benefit for the year. There is a cap on this. So big businesses that are maxing out, there's no reason they can't still give it to those other models that are going to sell it at a low price. But it is a barrier when they're choosing between places to donate. There are a number of state tax incentives as well. That's what I'm showing here. So it's worth looking at both if you're trying to get donated food as part of your model, or if you as a business are donating food, take advantage of these federal and state tax credits to make up the cost that you're using for food that you can't sell to get a reduction on your taxes. And I'm not going to go into this because we just heard about a lot of these, but just to say in the report, there are also a number of different innovative things states are doing. So if you're trying to work in the space, none of these programs are working for you, states care about this. They want their citizens to be, or their residents to be healthy and successful and have economic opportunity. And so states and localities are experimenting a lot with putting their own money into this as well. All right, I scratched the surface. I'll be here. I'm happy to talk more about this. And we also, our model is to work with, with organizations like yours. So reach out if we can help with any of these at any point.